Awesome. So we are streaming live on Facebook right now, COVID-19 vaccine education. I think we'll just give a minute or two to let people get logged in. And we have a few more who are joining on Zoom. So we'll just kind of hang out until then.
Yep. Sounds good, Nicole.
Normally we like to get started right away, but I think tonight we'll give people a few minutes to get logged in, and hopefully we won't run too far past the hour mark. But if people have lots of questions and want to stick around, then even myself can definitely stick around and answer those questions. Okay, great. We have a bunch of people already logged in on Facebook. Welcome to the vaccine education webinar. For anyone who's just logged in, we're just giving a few more minutes before we get started. So hopefully a few more people are able to join us. Okay, great. We have 17 people on Facebook now.
Did we want to start in like a minute, like 6:05? Okay.
Yeah, we can just start with introducing ourselves, and so yeah, why don't you go ahead and introduce yourself, Eve?
Yeah. So hi, everybody. Thanks for joining us tonight on the COVID-19 vaccine education. My name is Eve. I have been working with health services for a year now. My primary role is as a drug strategy coordinator. However, since COVID started, I have been redeployed into doing a lot of the COVID-19 efforts, building a lot of infographics and guidance documents related to all things COVID, including the vaccine education that we're presenting with you today. And I'm also joined by my colleague, Nicole, who does a lot of this work with me. And Nicole, would you like to introduce yourself?
Hi, everyone. My name is Nicole, and I am the Senior Health Promoter at Six Nations Health Services. And I've been working alongside Eve, doing a lot of the pandemic response work and education. And we are happy to provide the COVID-19 vaccine education tonight. We know there's a lot of information out there. It's hard to sort through. And for some people, it makes it a tough decision to decide if you should get the vaccine or not when you have trouble sorting through just the mountain of information out there. So tonight we're going to give you what I like to call a crash course in vaccine education, so a vaccine 101. We'll try and keep it as straightforward and simple as possible. And we want to dispel any myths around the vaccines. We want to answer your questions. And feel free to put any questions in the chat. We'll monitor the chat and be able to answer any questions that you have. Is there anything else we need to address before we get started, Eve?
Just that Nicole and I are not licensed practitioners or doctors or nurses. So if you have any type of personal health condition, please don't put that on the chat, as we won't be able to provide you with specific recommendations for your condition. We are just giving general information. And with that, I will let you know what we're actually covering today. So like Nicole said, we're going to dispel some myths. We're going to talk about how to verify reputable sources because as we say, there's so much misinformation that's out there. We're going to talk about the two different vaccine types, the mRNA and the viral vector vaccines, how they actually work. We're going to talk about the vaccine safety, so what actually took place for the vaccines to become what they are now, as well as the side effects and who can and who can't get the vaccine. So there are many reasons why you or your family might be unsure about getting the vaccine. And even if you've gotten it, you might still feel uncertain. And it's totally normal to feel that way because we're living through very uncertain times. And it's really hard to feel uncertain and unconfident when we are living in these times. So you might relate to any one of these reasons. So we're talking about historical trauma, such as the institutional racism and unethical research and experimentation that has happened and continues to happen to this day. Lack of information or education, because again, it's super overwhelming to understand where to go or find information. So not knowing enough about the vaccine or how it works. Believe myths or misinformation, such as the vaccine was rushed, the virus really isn't that bad, or we're just guinea pigs, and we will address that in a couple of slides. Distrust of the government, medicine, or science, again, due to the institutional racism and unethical research and experimentation that has happened. You could be in one of the special populations, so that means that they weren't originally considered in the initial clinical trials. So those are pregnant populations, breastfeeding, and as well as immunocompromised. Could just be scared of the side effects, which is also completely normal. And just general feelings of anxiety and nervousness, we understand, and that is completely normal as well. So we want to first cover some of the myths that we've been hearing. And during this time, if you see that there's any types of myths that we haven't addressed, just let us know, put it in the chat box, and we will try to address it the best we can. So the first myth that we get a lot is, I'll get COVID-19 from the vaccine. Well, you can't get COVID-19 from the vaccine because it's it's not a live virus, and it does not contain any live viruses in it that causes the COVID-19. It does teach your immune system how to fight the virus that causes COVID-19. Well, what about vaccines altering my DNA? Well, no, COVID-19 can't alter your DNA because both the viral vector vaccines and mRNA vaccines deliver a genetic material to our cells to start building protection against COVID-19. However, the material never actually enters the nucleus of the cell, so that's where our DNA is kept. So it doesn't interact with our DNA in any way. Well, the vaccines aren't safe because it was rushed. Well, Canada actually does have a very rigorous process to evaluating vaccines, and we'll go over that in a few slides. The vaccine will be mandatory. Well, the vaccines aren't mandatory, so that means that neither your employer nor your government can force you to get vaccinated, and it is a personal choice. However, we highly recommend it. So vaccination may become necessary to participate in certain activities, but we don't know if this will happen yet. So by that, we're talking about, you might have heard this week that the European Union and Canada and the United States may be requiring proof of vaccination in order to travel internationally. However, they are just in the talking stages of that, and they haven't made the vaccine certificates mandatory yet. And other vaccine myths. Well, there's a microchip in the vaccine. There are no microchips in the vaccines. They don't contain any software, and you can't be tracked. And that was a rumor that was misinterpreted when Bill Gates was talking about digital certificates that people would have once they have been vaccinated. Well, do vaccines lead to infertility? There is no evidence that fertility problems are a side effect of any vaccine, including COVID-19 vaccines. Confusion arose when a false report surfaced on social media saying that the spike protein was the same as another spike protein called syncytin-1, and that is involved in the growth in the placenta during pregnancy. So this report also stated that getting COVID-19 would cause a woman's body to fight this different spike protein and affect her fertility. The two spike proteins are completely different and distinct, and getting COVID-19 will not affect the fertility of women who are seeking to become pregnant, including through in vitro fertilization. Indigenous people are being used as guinea pigs. Well, we are not the first people to get vaccinated, and that's because within Canada, the vaccine rollout has been so slow that millions of people across the world have been able to get vaccinated before us. So Israel has fully vaccinated 53% of its population, which is about 5 million people. And Canada has also prioritized healthcare workers and the population 80 plus before Indigenous peoples. And finally, healthy people don't need the vaccines. Well, actually, think of the vaccines as an added layer of protection. So having a strong immune system may help you from a serious or fatal outcome if you do get the disease. We're seeing a lot of young and healthy people still ending up in the ICU, on ventilators, and then after coming out with serious long-term brain, heart, and lung damage. So getting the vaccine is an added level of protection you should have in addition to having a healthy lifestyle. So we're talking about making sure you're eating healthy, sleeping 7 to 9 hours a night, and getting regular exercise, plus having our bodies know how to fight off COVID-19. So COVID-19 is a new coronavirus. So that means that our bodies don't know how to fight it off naturally. And the vaccine's role is to teach our bodies to fight it off if it encounters it. Are there any other myths that we haven't addressed that you can think about?
We have one already. Myth or not that there are egg components in the vaccine, so someone with egg allergies couldn't get it.
No, there are no eggs in or egg proteins in the vaccine. And we do actually have a slide of what ingredients are in the vaccine that might help you out a bit.
So Candace, do we have any other myths that people shared on the Facebook chat? Okay, you can feel free to put them in if you think of them later. That's fine. We can address it later. So we'll just move on for now.
Sounds good. So speaking about myths, we find that oftentimes the media sensationalizes stories and stretches the truth to make stories seem far worse than they are. So there is a lot of misinformation that's going around, and it can be quite confusing and quite overwhelming to know what information you can trust and what information is wrong. So social media sites like Facebook are known to propagate fake news stories and conspiracy theories. So we have to be extremely critical of anything you find on social media. So how can we spot fake news? Well, first consider the source. Is it from a trusted news site such as CBC, or is it an information that you're reading in a blog? Also, read beyond the headlines, as headlines are meant to capture our attention, but they often don't tell the entire story until you read the full article. Also check to see if the author is real, and also what other types of articles they write. Is it satire, or are they verified journalists or bloggers? Also, sometimes if the articles might seem so far-fetched, check if it is satire, as some websites, such as The Onion and The Beaverton, are known to post stories that look real, but are actually a joke. And when in doubt, ask the experts, such as your healthcare provider, or consult some of the resources we have in this next slide. So these are the sources where we got all of our information from. The following sources have web content that is researched, written, and approved by subject matter experts, including physicians, researchers, epidemiologists, and analysts. So the content is based on peer-reviewed science. So that means that it has been double-checked to ensure accuracy by many people in the research field before it is published to the public. And as the information on COVID-19 is rapidly changing, these sources are frequently updated to provide you with the most up-to-date information. So, in general, how do vaccines work? Well, vaccines in general teach your body how to protect you from disease. because it is much safer for you to learn, for your immune system to learn this through vaccination than by catching the disease and attempting to treat it, as it is a novel virus that our bodies do not know how to fight. So speaking of that, I will just stop sharing the screen a bit and share a video with you all.
Vaccination protects us from diseases. Keeping your immunizations up to date will protect your family from disease and reduce its spread in your community. Let's look at how immunizations keep you healthy. Vaccination introduces a portion of a weakened bacteria or virus into the body, usually by injection. When your immune system goes to work, it's as if you were exposed to disease. But here's the difference. Virus or bacteria in a vaccine won't make you sick. Instead, the vaccine prepares your body with a defense. And because vaccines provide such a tiny amount of virus or bacteria in an injection, getting more than one vaccine at the same time won't overwhelm your immune system. Dead or weakened viruses and bacteria are the main ingredients in vaccines. But vaccines may also contain adjuvants to help the body's immune system respond better to vaccines, and additives and preservatives to maintain the quality and effectiveness of vaccines over time. These ingredients are safe. In fact, many of them can be found in the foods we eat or in nature. Canadian laws and regulations set high standards for vaccine development, safety, and testing. Canada also has strong health systems to oversee and monitor vaccines as they arrive on the market and are sold to the public. Vaccines are safe. Talk to your doctor, nurse.
So that was just a short video of how vaccines work, and I'm just going to go back to the slides. Were there any more myths that were addressed or should be addressed?
No, not yet.
Okay. Okay, so there are two types of vaccines that have been approved in Canada. So one is the mRNA vaccine, and that includes Pfizer and Moderna. So they use the mRNA vaccines, which teach our cells how to make a protein that triggers an immune response. The viral vector vaccines, which include the AstraZeneca and the Janssen by Johnson & Johnson, are viral vector vaccines that use a modified version of a different harmless virus to deliver important instructions for our cells to make their spike protein. So here is a comparison of the 4 vaccines that have been approved. So why do some seem like they're less effective than others? So why does Pfizer have a 95% efficacy rate? And why does AstraZeneca have a 62% efficacy rate? Does that mean that AstraZeneca is the least effective? And does that mean with AstraZeneca, I have a 38% chance of catching COVID? Well, no, and this is why. So think of it as more of a ratio, the likelihood of you catching COVID-19 every time you're exposed to it. So if you're not vaccinated, every time you're exposed to COVID-19, you have a 100% chance of catching COVID. However, with AstraZeneca, you have a 62% less likelihood of a chance that you will catch COVID every time you're exposed to it. As well, the reason that the efficacy rates were different was because the vaccines trials took place at different times. So for Pfizer and Moderna, the trials took place in the US from August to November of 2020. However, the Janssen by the Johnson & Johnson and the AstraZeneca trials took place in October to January of 2020. And they also took place in other countries such as Brazil, South Africa, and the UK, where case rates were super high. And that gave people more of an opportunity to be exposed to infections. Because the Janssen and the AstraZeneca vaccines took place in other countries where the virus at the same time, as we remember, that is also the same place where a lot of the variants had mutated to, and they still showed protection against moderate to severe cases of COVID-19. So what we have to remember is that these vaccines protect us from moderate to severe cases of COVID-19. So that means that by getting the vaccine, it protects us from going to the hospital and ending up on a ventilator. And this is also why you can't make a one-to-one comparison to the vaccines, as they were all done at different times during different circumstances. The vaccines aren't perfect. So that means that even if you did catch COVID-19, it is a small possibility, but you could still happen. It is a much milder version. So please don't engage in vaccine shopping. If you are offered a vaccine now, take whichever one you can get. In our community, we are offering the Moderna vaccine at our clinics, and some protection is better than no protection. And if the vaccine type you get requires 2 doses, you absolutely must get the second dose to get full protection. So let's talk about the mRNA vaccine. So that is the Pfizer and the Moderna vaccines. So in general, coronaviruses, like the one that causes COVID-19, they're known for their crown-like spikes on their surface, which are called spike proteins. And these spike proteins enter our cells and infect us with COVID-19. However, these spike proteins themselves are not harmful. So these spike proteins are what the vaccines target in order to build our immune response. So I'm just going to show you another short video as to how mRNA vaccines work.
When we get vaccinated, we protect ourselves from illness. We also help to stop illnesses like COVID-19 from spreading in our communities. All over the world, researchers are working on more than 50 kinds of COVID-19 vaccines. Soon, our communities will get the Moderna vaccine. It is an mRNA, or messenger RNA vaccine. What does that mean? Genes carry information that make up each living thing. Messenger RNA is a tiny molecule that carries the gene's instructions. Its job is to go out and tell cells how to make proteins. There is RNA that tells our cells how to make proteins that will help with removing waste, maintaining the cell structure, or communicate other actions. The new coronavirus has spike proteins that stick out all around. The spike protein helps the virus attach itself to our cells and infect them. The instructions for making these spike proteins are found inside the virus as messenger RNA. In the lab, researchers found a way to copy this messenger RNA and put it into the Moderna vaccine. When we get the vaccine, our body starts making a copy of the virus's spike protein. Because it is only the one protein we are making, it cannot give us COVID-19. Our body's immune system sees right away that these spike proteins do not belong to us. This makes our body fight them off. Our immune system remembers what these proteins look like. If the real coronavirus enters our body later, our immune system recognizes the spike proteins. It kills the whole virus before it can make us sick. The Moderna researchers tested the vaccine with many thousands of volunteers to make sure that it is safe. We hope that this helps you get a sense of the science behind the vaccine. Here are some places you can get more information that you can.
All right, so that's just a short little video of how the mRNA vaccines work. I'm just going to bring you up to my slides.
So I just want to reiterate for everyone what was in that video. So basically the vaccine, the mRNA vaccine, it has a set of instructions. And I like to think of it like a teacher. There's a little teacher in the vaccine, and when it goes in your body, it takes the instructions and tells your body how to react if it encounters the virus. So the vaccine doesn't actually stick around in your body. Once it transmits that knowledge to your body, it sheds from the body and it doesn't stick around. But your body now knows how to fight the virus if it encounters it.
Thank you for that explanation, Nicole. It was perfect. And speaking of, there has been a lot of talk about the mRNA technology being new. Well, this is actually a timeline to show you that the mRNA technology is not new, but has been studied for decades by researchers. So in prior vaccine development, you would usually grow a virus in a lab, which can take several weeks or months. However, interest has grown in these mRNA vaccines because they can be developed in a lab using readily available materials. So that means that the process can be standardized, scaled up, and making vaccine development faster than traditional methods of making vaccines. And the mRNA vaccines have been studied before for the flu and Zika and rabies. So as soon as the necessary information about the virus that causes COVID-19 was available, scientists began designing the mRNA instructions for our cells to build the unique spike protein into the vaccine. So there's, again, another type of vaccine, which is the AstraZeneca and the Janssen are viral vector vaccines. So those use a modified version of a different virus called the vector to deliver important instructions to our cells. So first, the viral vector, which acts as a delivery shuttle and is also a harmless virus, will enter a cell in our bodies. The vector teaches our bodies how to make copies of the spike protein. Our immune systems recognize that the spike protein doesn't belong in our bodies, and that triggers an immune response to produce antibodies, which fight off the spike protein. And at the end of the process, our bodies have learned how to protect us from COVID-19. As well, the viral vectors technology has also been studied for decades. So it has been used in gene therapy for cancer and recently to treat Ebola. So a question before was what's in the vaccines? Well, first is the mRNA such viral vector. So that tells our bodies how to make the COVID-19 spike protein. The fat molecules protect the mRNA and the viral vector and carries the mRNA and viral vector into our bodies. The salt keeps the pH or the acidity of the vaccine safe. The sugars help keep the vaccine components safe and stable when it's being stored. And the saline solution makes sure that the vaccine salt content is the same as the salt content in our blood. So again, there are no microchips or preservatives, blood products, fetal cells, or eggs in the vaccines.
And just a note on that, Eve, that that there are no preservatives in the vaccines, and that's why they need to be kept at such cold temperatures. So the Pfizer, for instance, needs to be kept at a -80 temperature and the Moderna at -25, and that's because there are no preservatives in them.
Exactly. So, like all other vaccines that have been authorized for use in Canada, the COVID-19 vaccines are held to the same high safety, effectiveness, and quality standards. So once a COVID-19 vaccine has been authorized for use in Canada, they continually monitor it for its safety and its effectiveness. And we'll briefly go through the process of how the vaccines go through clinical trials and get approved for use in our population. So first, we're talking about the preclinical trials. So the scientists test the new vaccine on the cells and then give it to animals such as mice or monkeys to see if it produces an immune response. If that works and it doesn't have any fatal consequences on the animals, we will move on to the phase 1 safety trials. So here in the safety trials, the scientists give the vaccine to a number of people to test the safety and dosage, as well as to confirm that it stimulates the immune system. If there are no adverse effects, then we move on to phase 2, which are the expanded trials. So here, scientists give the vaccine to hundreds of people that are split into groups to see if the vaccine acts differently in them. These trials will further test the vaccine's safety and ability to stimulate the immune system. When that is successful, we then move on to phase 3. So here, scientists give it to thousands of people. So by thousands, I mean that Moderna tested about 33,000 and Pfizer tested about 44,000. Half get the vaccine and half get the placebo. So that's a vaccine that has no therapeutic effect. And then scientists send them off to live their regular lives to see if they catch COVID-19 over the next several months. This then determines whether the vaccine protects against the coronavirus. So it then goes off for scientific review, where a team of experts from Health Canada conduct a thorough independent research. If all is safe, the vaccine then gets sent for approval, and they then coordinate the logistics of distribution across Canada and continue to monitor it for its effectiveness. So it is actually true that normally vaccines take an average of 10 years to approve, and that's due to a couple of things. Well, one is actually funding. So often scientists have to look for funding after each phase of development of a vaccine, and they're also often in competition with each other. So when I say that, I mean they often only have enough money to go on to phase 1. Then they have to look for funding into phase 2 and again for phase 3, and that usually delays the work for years. In the case of COVID-19, this was not an issue. Because this is a global pandemic that has been affected by everybody, there was a global collaborative effort by all the companies who wanted the same thing, which was to find a vaccine for COVID-19. So instead of all the companies being in competition with each other and the governments only handing out funding to certain companies, they were able to all get together and collaborate in order to find a vaccine. As well, due to the impact that COVID-19 has had on a global scale, instead of all the scientists working on their own research projects, all the energy and research has gone into finding a vaccine for COVID-19. And another reason normally is that all the 3 different phases are happening at different times. Again, usually because there's a funding issue. However, in this time, phases 2 and phases 3 were done at the same time with the help of volunteers and sufficient funding. So that means that in the end, the data and the safety tests are the exact same as the other vaccines that have been approved in Canada. It just took less time.
And so just to summarize that information a bit for everyone, this is a comment that we get all the time, is that the vaccines were rushed and they're not safe. How do we know? But hopefully you were able to understand from Eve's explanation that there really was a global collaborative effort to make this happen, and no steps were skipped. So every single country in the world was affected by this. When you think of other epidemics like Ebola, for example, that really only affected Africa, which is a poor developing continent, and there wasn't a lot of incentive to get vaccines made for that disease. So there's a huge incentive for the whole world to get on board with collaborating to develop the COVID-19 vaccines. And again, no steps were skipped. Normally, as Eve explained, it takes a long time because of the competition for funding. And there plenty of diseases could have already had a vaccine developed if there was the same type of global collaborative effort put towards them as there has been for COVID-19. So there really is no reason why a lot of the diseases that do exist shouldn't already have vaccines, and that's due to political and financial reasons, and who is actually affected by those diseases. So those are all reasons why it seems like it was rushed, but it really was not.
Yeah, thank you for the clarification on that explanation. It is quite true. Well, we're going to talk about side effects and what to expect after getting vaccinated. Well, some people can develop mild side effects in the days after you have been immunized that are generally not serious, and they go away within 24 to 48 hours. So these types of side effects are expected, so they're completely normal, and they simply indicate that the vaccine is working to produce protection. So we have had a lot of people ask, are the side effects worse after the second dose? Because some people have had them and some people haven't. So maybe it really depends on our body's reactions. So some people have more side effects after their second dose. Some people have more side effects on their first dose and none on their second dose. And some people have no side effects at all. So everybody's body is very different, and we really can't predict which side effects you will get and how intense they will be. And as an example of the different types of ways our bodies are reacting to the side effects, for myself, when I got the first dose, my arm was a little bit sore. But when I got the second dose, my arm was really sore for about 24 hours. And that was about it. I didn't really experience any other side effects other than that. But Nicole's side effects, if you'd like to share, are completely different from mine.
Yeah, on my first dose, all I had was a sore arm. It was sore for a couple days, and I couldn't sleep on it. The second dose, I also had the sore arm. I also got a headache, fatigue, and chills. So the next day, I wasn't, feeling 100%, but I just kind of slept it off, and by the end of the day I was pretty much back to normal. We did get a comment that said, I know someone close to me that was in bed for 2 days after the second dose. That's totally normal. So when we say on average the side effects will go away within 24 to 48 hours, that keyword is average. So that means some people, their side effects might last a lot shorter. Some people it even lasts longer. So some people might have side effects, up to a week afterwards, and that is all normal. It really just depends on your body and how your body reacts. I Personally, I was actually excited to get side effects because I knew that my body had learned how to fight off the virus. So, but if you don't have side effects, it doesn't mean that you aren't protected. But for me, I just thought it was so cool and exciting that my body knows how to fight the virus now. But it is totally normal to feel under the weather. And also, like Eve's experience, is totally normal to just, feel normal.
Yeah. And I would rather have this than have COVID or any of the long-term effects that could happen if I did get COVID. So side effects are completely normal. They just indicate that your body is producing the immune response to protect you from if you were ever exposed to COVID-19 again. So while it is normal to experience the side effects that we talked about before, in very rare cases, some people who are allergic to the components of the vaccine may have what is called a serious adverse event. So the signs are usually if you have hives, trouble breathing, swelling of the face or throat, rash, fevers or convulsions or seizures. So this, and I have to stress, is very rare and it is quite abnormal. And it usually presents itself between 0 to 30 minutes after receiving the vaccine. So that's why you actually have to stay for a 15-minute observation period after the vaccines. And at the vaccine clinic, there are paramedics, nurses, and a physician on site at every single clinic. So you will be in good hands if anything does happen. So speaking of side effects, how many have actually happened in Canada and how many have happened in 6 nations? Well, these are all the serious adverse events that have been reported by public health units to Health Canada. So far out of the almost 12 million doses that have been administered, there have been 617 serious adverse events reported. So that's less than 1% of all vaccines administered. And the benefits of the vaccines continue to outweigh the risks of catching COVID-19 and any complications that could occur from catching COVID-19. And in our community to date, we have had 1 serious adverse event out of the more than 2,000 doses that have been administered. So who can get the vaccine? Well, all adults, so ages 12 plus for Pfizer, as of today, Health Canada has authorized the use of the Pfizer vaccine to anyone 12 years and older. However, for all the other vaccines, it is 18 years and older. And as well, if you have any type of allergies, that you can definitely get the vaccine. So if you have hay fever, if you have asthma or eczema, if you're allergic to any type of food, latex, medication, or any type of bee stings or spider bites or any of those things, as long as you're not allergic to the components of the vaccine, so we'll talk about that in a couple slides, you can get the vaccine. With consultation from your physician, if you are pregnant, breastfeeding, or immunocompromised, you can get the vaccine. As well, if you've had a COVID-19 infection with your symptoms resolved and you've been cleared by public health and you're not under isolation, you can get the COVID-19 vaccine, as well as those with underlying health conditions. So that means if you have diabetes, hypertension, high blood pressure, COPD, you can get the vaccine. If you are at all unsure, please talk to your healthcare provider before booking an appointment. However, there is a physician on site for counseling at the clinic as well. So when we talk about special populations, we're talking about these groups because they were originally excluded in the vaccine trials. So that doesn't mean that you can or shouldn't get the vaccine. It is a personal choice, and the risks of getting the virus may be greater or lesser than getting the vaccine. So again, the same thing goes. If you're at all unsure, please talk to your healthcare provider before booking an appointment. And you may also prefer to have a conversation with your own provider who is familiar with your situation. However, for pregnant women, real data is coming out where pregnant women who are self-reporting that they are pregnant is showing that the vaccines are not only safe in pregnant and breastfeeding women, but they may also offer some protection for their babies. We also spoke to the birthing center, and they are supportive of pregnant and breastfeeding women, as well as women who are trying to conceive and getting the vaccine, as long as they consult with their midwife and physician beforehand. So who can't get the vaccine? Well, if you're allergic to the following ingredients, so we're talking about polyethylene glycol and trimethamine. So polyethylene glycol and trimethamine are chemical compounds and can be used as an additive in certain foods, laxatives, and cosmetics. If you've had an immediate or delayed severe reaction to the COVID-19 vaccine, as well, if you're currently have COVID, you're still in isolation or still symptomatic, you have to be cleared by public health in order to get the vaccine. And as of today, children who with the Moderna vaccine, AstraZeneca, and the Janssen vaccine. So as I said, as of today, Health Canada has authorized the use of the Pfizer vaccine in anyone 12 years and older. Clinical trials have started for children ages 5 to 11 with no result out yet, but they will be out soon. And as well, Moderna and AstraZeneca are currently studying how the vaccine works with children under the ages of 18. So you might have heard about the AstraZeneca vaccine and how they've stopped it for use in the US and as well as other Scandinavian countries due to some rare side effects that have resulted in blood clots. Well, just showing you in this infographic that compared to smoking and taking birth control, there is a very low risk of getting blood clots in the AstraZeneca vaccine. There is also a significantly higher risk of blood clots if you're not vaccinated and happen to catch COVID-19. We also want to note that this is a treatable blood clot and that the vaccine will continue to save many lives, especially those who are at higher risk of COVID-19 complications due to age or due to risk of exposure. So we do want to highlight the rare side effect of the blood clots, not to dismiss the experiences that people have had, but to honor them and to recognize the complications so that we can learn more about it and let people recognize it earlier so that people can be treated for it.
Just on that note, Eve, so the title of this slide is Putting Fears into Context. And we want to recognize that it's a very scary time right now. We are in the middle of a pandemic. We've been here for over a year. That's very crazy. Nobody who is alive right now has experienced this on this scale, and things are very uncertain and scary. So it's normal to be, concerned about the vaccine and just the whole situation that we're in. But putting it into context, we put ourselves at risk all the time, and we're not fearful of it. So every time you get in a car, you have a much higher chance of getting in a car accident than you would, for example, getting a blood clot and dying from the AstraZeneca vaccine. So It is scary, and it's normal to be fearful of these side effects and potential risks, but there are many more things out there that are much more put us at much greater risk than the vaccines.
Yep, exactly. Thanks, Nicole. So what do we know about the vaccines? Well, we know that they're safe, and we know that the safety standards have increased dramatically over the last several decades. We know that the risks are very low. So the amount of serious adverse events in Canada account for less than a percentage of all doses administered. We know that having some protection is better than having none. We know that the risks and consequences of getting the virus are potentially greater than getting the vaccine. We know that there are no other long-term consequences for other vaccines that have been done in the past. So we're talking about the polio, MMR, rabies vaccines. But however, they are not the same as some of the drugs that have been given that have ended up being unsafe for pregnant women. So the thalidomide in the 70s. We do know that there is a chance you could still catch COVID-19 because, again, vaccines are not perfect, although it will always be milder, and it will prevent you from getting a very serious case, ending up in the hospital or in the ICU. And we know that they aren't allowing us to go back to normal just yet. So what we mean by that is even after we get vaccinated, we still have to follow the same public health guidance, such as masking, hand washing, and social distancing. So think of vaccines as a layer of protection. And I will show you one last video of what I mean by that. So that's what I mean by layers of protection. I'm just going to go back to sharing my screen.
And in addition to that, so the vaccines are an added layer of protection along with all the other all the public health measures that we talked about and that are in that video. But another factor to consider is that not enough people are vaccinated for us to be able to eliminate those measures. So right now on reserve, we have maybe 10% vaccinated, at least one dose. So we would need, around 70 to 80% of not just on reserve, but everyone that we would have contact with. So everyone in the surrounding area, potentially the province, the country, North America, we need to achieve herd immunity, which would be, like I said, upwards of 70 to 80% of the entire population before these measures can be totally lifted. So there's a lot of people who are unprotected right now. So although it's good for you and protects you to get the vaccine, there's so many people who don't have it that are unprotected right now. So we're still in this middle stage where we're trying to get as many people vaccinated as possible, but until we reach that threshold, we have to keep following the precautions.
Exactly. Thanks, Nicole. And speaking of that, well, what don't we know about the vaccines? So we don't know exactly how long the vaccines provide immunity. So far for the Pfizer and Moderna, they state that the vaccines provide immunity for at least 6 months and that they're also 91% effective at that. However, that doesn't mean that at 6 months and a day, they've stopped providing protection. It's just that they've been following the people from the clinical trials and they've found that each month they've been following them, it still provides that same protection. If there's any long-term side effects that could occur, however, that is highly unlikely because there have never been any side effects from any other vaccines before. Whether we need booster shots, so that might be likely as new variants arise, and Pfizer is working on a booster shot currently. Exactly how long the vaccines are effective against new variants. So the research is ongoing, but early data states that the vaccines approved in Canada, so we're talking about the Pfizer and Moderna and the Janssen, are all effective at protecting with the B117 or the UK variant. And they also still offer full protection against moderate to severe COVID-19 illness. The AstraZeneca is slightly less effective to the South African variant, but still offers full protection against moderate to severe illness of COVID-19. And also remember that not getting vaccinated doesn't offer you any protection at all. So getting some protection is better than getting no protection. So what are some of the benefits of getting vaccinated? Well, one, it prevents and reduces the impact of disease in the population. Again, it's an added level for protection for you and the community. It protects you from getting COVID-19 or a serious case of COVID-19. And it is safer to teach your body how to fight infection with a vaccine rather than to take the chance of fighting it naturally. The more people who are vaccinated, the safer it is to go to work, school, and to see your family, to see your friends. There's an ease of mind knowing that your family and you are at lesser risk of severe disease or death if you get the virus. And the more people that are vaccinated, it means prevention of more transmissible and or deadly mutations of the virus. So we still have many appointments available at the vaccine clinics, and they are open from Monday to Friday. Sorry, the call center is open from Monday to Friday, usually from 9 a.m. till 8 p.m. And you can also book online as well. And that really concludes our portion of the vaccine education. If you have any questions that weren't addressed through the presentation, feel free to ask now.
Yeah, we have a bunch of questions, Eve, so I'll just read them out and we'll try and answer them as best as we can. So someone made a comment about vaccines having chemicals in them, and if I'm on medication, how do I know my body won't reject all these medications? So, well, your medications are have different components of them that could react with other medications. Right now, there are no contraindications for the vaccine. So if your doctor says that it's safe for you to get the vaccine, given the medications you're on, you can go ahead and do that. There are also physicians on site at every clinic who can answer your questions specifically. So if you're on a specific medication that you're concerned about, you can talk to the physician there. When will you need boosters? So you've already talked about this one. We don't know. We don't have that information, but it's likely that we will need boosters in the future. Does the pharmacy on Six Nations do vaccines? Nope. Right now you have to go to the vaccine clinic. Or you're welcome to get it at a pharmacy off reserve as well.
But it won't be the Moderna or Pfizer. It will most likely be the AstraZeneca vaccine. So
yeah. How are you tracking those vaccinated off reserve? So you can call public health and report report yourself that you were vaccinated off reserve. So can you answer this one, Eve, about how effective the vaccine is against the new variants?
So they do offer some protection against the variants. So there wouldn't be 95, let's say the Pfizer and the Moderna wouldn't be 95 to 94% effective. However, they are still very effective at protecting against the variants. And they're still finding that they are very highly effective at preventing severe outcomes of the disease. So that means that people who are vaccinated have found that they are not going to the hospital, they're not ending up in the ICU. We're actually reducing that load on the ICU in the hospitals, even with the variants that are circulating around. And there are no long-term risks. So there haven't been any long-term effects from the vaccines. In the past, like, think about all the vaccines that we've had before. And also think about the flu vaccine that happens every year. We've never had any long-term effects from any of those vaccines. So we wouldn't have any long-term effects, most likely, from these vaccines as well. And also, we only have data up till 6 months because the trials were done at longest 6 months ago. And they're also finding that there are no long-term risks. And
Okay, so comment about Pfizer causing some heart problems. So that was from reported from Israel, the Israel Ministry of Health. The number of people who reported that was 62 out of more than 5 million. So that's 0.001%. That's basically zero. So that's not a concern. Brand name meds don't work the same as no name brands. That's not true at all. A lot of times no name medications and brand name medications are essentially the exact same, but might have one tiny little component that just allows the no name to still be manufactured, but not with the brand name on it. So that's false. So I don't know how that would, so I'm not really sure what you mean by that. How do you know they are made equally? So all the vaccines are different and are produced differently, but they're all effective at preventing infection of COVID-19 and preventing serious cases of COVID-19. So yeah, they are different and they're made differently. Some are more effective than others, but they are all effective. Yeah. Do you need to be vaccinated if you already tested positive? Eve, can you address that one?
Yes, because we don't know how long you are immune to COVID-19 for after. So we do know that if you've tested positive for COVID-19, you do have some immunity, but we don't know how long that's for. That could be for 30 days, 90 days, who knows? But we do know that getting vaccinated provides you with really good immunity for at least a few months. So please get vaccinated. And also, if you don't get vaccinated, you could get the virus again, and it could be way worse, and you could end up with long-term complications. So if you get vaccinated, that is, again, one layer of protection and a very strong layer of protection in fighting COVID-19.
Okay, so if you got your first dose of Moderna off reserve, can you receive the second dose on reserve? So my question to you would be, why is there a reason why you can't return to the public health unit where you initially got your first dose? That's what we would direct people to do, is go back to where you got your initial first dose. If there's some very extenuating circumstances, you can call the vaccine booking center and explain your situation. But if you got Moderna off reserve, just go back to the health unit where you did get it first. Mm-hmm. How long has this vaccine been around? So we did talk about this. So they got started immediately, right away, and there were clinical trials almost a year ago that were occurring. So We also talked about the mRNA technology being under development and being researched for the last 60 years. So it's not all totally new. Yes, the virus is new and the actual COVID-19 vaccine is new, but the technology has been around for a long time.
Yeah.
What is, yeah, go ahead.
Yeah, for that question, what the efficacy rate is, so it's about 70 and 80%, so around 70 to 80% effective for both Moderna and Pfizer. But again, they don't know how long that lasts with just one dose. So you get that one dose, it might be 70 to 80% effective, but we don't know how long that lasts. However, getting that second dose will provide you with that full immunity for that extended amount of time that we have seen.
Yeah, because we can't say how long the first dose actually provides you immunity because it was never studied that way. It was only studied with the 2 doses. So you definitely, if you got your first dose, you have to get your second dose to get that full protection. And like Eve mentioned before, it's for at least 6 months, maybe even longer. We don't know exactly how long. It could be a year, it could be more than that, but you need that second dose. So if you're scared of side effects from the second dose, hopefully you heard from our experiences that, you know, Eve didn't even get any side effects besides a sore arm on her second dose. And I had some side effects on my second dose, but honestly, they were not bad at all. I was scared of getting side effects with my second dose. But then when I got it, I was like, oh my gosh, that really wasn't that bad. I would go through it. If I had to get a vaccine once a month to be protected, I would do it. It really, it would definitely be worth it.
Yep.
What can we do regarding misinformation on social media? Well, that's a tough question. We are on Facebook right now, which is a social media platform. I would just get off social media. It's not, you can't trust what is being circulated on social media. You know, people who are engaging in conspiracy theories and whatnot, unfortunately, there's not a lot you can do to change their minds. So, you know, we would prefer you to focus on, you know, having conversations in person, or not in person, but like with an actual person and not just behind your computer screen, because that's where all the conspiracy theories are happening. So actually just talking to people and saying, well, why are you concerned? You know, what are your worries? Turning them towards some of the reputable resources that we shared. Any other advice for that, Eve?
And if you do feel the need to address them, don't address them in the comment section. Just address them one-on-one. Send them a Facebook message or an Instagram message, as people are more likely to engage that way. And like Nicole just said, where are you coming from? Well, I actually heard from this verified reputable source that it's actually this, and really don't just be willing to understand that they might stand their ground, and that's okay. There's only so much that you can do. You've done the best that you can regarding educating them in the right way, and if they don't agree with that, that's fine. Just move on.
Yeah. Is there any difference between immunity from being tested versus being vaccinated? So I'm assuming you mean from getting the virus versus being vaccinated.
Yep. So like we had said, when you get the virus, we're not sure how long that immunity lasts. So they have said anywhere between 30 to 90 days. However, they don't know what happens after 90 days. And again, you're not protected at all if you were to ever encounter COVID-19 again, which is quite possible. However, when you get vaccinated, that provides you, at least with the 2 doses, of 94% immunity for at least 6 months. And that is, again, a layer, a really good, strong layer of protection that could prevent you from catching COVID-19. And even if you did, it will fully protect you from getting a severe case of COVID-19.
Yeah, so the next question we already addressed. So with the 2 doses, you're protected for at minimum 6 months. It could be longer, but we don't know how long. I was diagnosed with COVID-19, the UK variant, and cleared April 19th. Can I go for my first vaccination Friday, May 7th? If you have been, so there's two factors. You have to have been cleared from public health, which you have been, but 2, you have to have all your symptoms resolved. So if you have any lingering symptoms, you just have to wait for those to clear up before you can get your dose. If you already have your appointment, but you still have some lingering symptoms, then you can call the vaccine call center and you could reschedule. But if you don't have any symptoms anymore, then yes, you're good to go. Comment, I am pregnant and due in July. I'm uncertain about being vaccinated. So Eve, can you just revisit what our comments were on pregnant women getting vaccinated?
Yeah, so it really is your choice, and it's a risk benefit analysis, right? Like, how risky is it if I catch COVID-19 while pregnant? Well, it is very risky because you're pregnant and considered immunocompromised right now. However, vaccination has been shown to provide really good protection for mom and also provide some protection for babies. If you're at all unsure, again, we do have a physician on site. And if you want to talk to your healthcare provider, your midwife or your obstetrician, if you are still unsure, talk to them before getting the vaccine.
Yeah, and when we talked to the birthing center too, just reiterating that comment that they said they're in full support of pregnant women getting the vaccine. You're also welcome to call the birthing center, even if you're not a client there. I'm sure they'd be happy to take your call and just to ease your mind. Are there any anti-inflammatory drugs in these vaccines? So we already covered what the ingredients are. There's the mRNA or the viral vector. There's fats, salts, sugars, and that's pretty much it. Yeah. So no. Any other questions coming through, Candace, or comments?
These are all great. These are all great questions. I love that you all are really engaging with us. So thanks. We really appreciate that.
We got a lot of questions that we haven't had before, so this is great. Hopefully this education session has been helpful to you. Again, it is a very scary time, and I know when I sat down to get my first dose of the vaccine, like it just hit me, the nerves, like, oh my gosh, we are in a pandemic and I'm getting a vaccine for this dangerous virus. But then I thought about being protected and my family being protected, and that was helpful. So is it rare to get COVID more than once? So yes, it is rare, but it does happen, especially with the new variants, which means that the virus has mutated. So if you can get the virus again, and it could be fairly soon after you get it the first time, especially if it's a different variant. So it's not worth it. It's 100% not worth it to take the chance to get the virus, because there's no guarantee that your second time getting it would be less intense. It could be worse than the first time. So if you got it one time and you were, had just mild symptoms, that doesn't mean the second time you get it that it would be mild again. You could end up with a much more serious case. So what do you suggest for immune system boosting or maintenance? So we don't, we only address, we can only address like having a healthy lifestyle. So of course, exercise, sleep, healthy diet, vitamin supplements, those kind of things are all great for boosting your immune system and keeping you more more healthy and able to fight off any diseases or viruses that you come in contact with. But really, the vaccine is going to be your most effective way to do that. So don't rely on your immune system, because your immune system doesn't know how to fight the virus, and that's why it really can affect so many different systems in your body, because our bodies don't know what to do when it encounters it. So don't rely on just a healthy lifestyle, although you should do that as added benefit. But to prevent infection, you need to get the vaccine.
Yeah, and think about the vaccine. Well, also think about a healthy lifestyle as just one part of keeping your body healthy. So the vaccines are the other part. So you can't, so one part, like we said, is not perfect. So just having a healthy lifestyle is really good, but might not help, especially if you encounter some of the variants. You are still still have zero protection if you do get exposed to COVID-19. However, with a vaccine, you're now all of a sudden you go from zero protection to, if you had the Moderna, and if you had got both doses, you're now 94% protected, if that helps and makes sense.
Yeah, so it goes back to that video we showed on the Swiss cheese model, that all these layers add up to give you a better chance of not getting the virus. So keeping your distance from people, being in well-ventilated spaces or outdoors, getting vaccinated, and yeah, healthy lifestyles do fit into that. But I think the thickest layer and the one with the least amount of holes in that Swiss cheese model is getting vaccinated. So will you continue with these webinars? So this is actually our last webinar. We did them all on Zoom before, but if we have a lot of if we get another request to do it on Facebook Live again, I think we would definitely do that if the demand is there. Maybe Candace, can you give us an update how many people have actually joined us over Facebook? So vitamins B, C, D, and zinc are best. So I would recommend talking to one of our dietitians at Six Nations Health Services if you have questions about what kinds of supplements or diet you should have. We can't give any specific medical advice. So I think the questions are kind of winding down. We can stay on for a few more minutes just to see if anything else comes up.
Yep.
So I'm just asking Candace, we have an evaluation form that Candace is going to post on to those who are on Facebook. If you could fill it out and just give us feedback on the session, that would be really helpful to us. It just takes a couple minutes. Just any comments that you might have for us. So if we don't have any more questions, then we can probably close it out for the night.
Yeah.
Do you have any final comments, Eve?
No, I just want to thank you all for joining our presentation and asking all the questions. Made it really interactive, and we really like that. And we love having questions that we haven't had before that make us think. So thanks.
Yeah, and I hope it was helpful. If you have any other questions, you can feel free to email us with anything if it comes up later. But we do hope if you haven't been vaccinated that you will make an appointment at the clinic. It's at Gaylord Palace Arena. We have several clinics offered throughout the week. There's even evening and weekend clinics. Lots of spots available. We have lots of vaccine available, so you don't need to worry about there being enough. If you haven't been vaccinated, you should. We strongly recommend that you go get vaccinated. It's to protect you and to protect our community as well.